Hello everyone, today we will try to explain febrile seizure, which is actually a very important topic that every parent should have knowledge about. Okay, febrile seizure having actually a specific age, which is mainly an age between 5 months to 5 years. And usually the fever is about 38 Celsius and more. And there should be no previous CNS infection or a prior history of a febrile seizure. Okay? Febrile seizure actually having two types, simple and complex. And simple one and complex one. Simple one is the one that is lasts less than 15 minutes and there are no focal feature and there is no second attack within the same 24 hours. While the complex one is actually completely opposite. So it's actually lasts more than 15 minutes. There will be a focal feature and there is a second attack within 24 hours. So second attack within 24 hours. But the risk factor actually is very important because it determines the people that are more likely will have a febrile seizure. And these people are actually who have an existing neurological impairments, and those who have actually a viral infection. In European countries, it's mainly Rosella virus, and while in Asian countries, it's more likely influenza A virus. And family history of first-degree relative of febrile seizure. Because actually they have found that febrile seizure is associated with some genetic components and the main age of this age group is actually the age of infants, or let's say 1 to 2 years. Specifically, it will affect that age. So 1 to 2 years will have more likely to have generalized seizure when the fever is greater than 38 Celsius, because the brain is still immature, so there is lower threshold to having seizure. Neuronal excitation will be more likely to occur because GABA inhibitory signal is not work efficiently. Neuronal excitation will end up with febrile seizure. Treatment actually will depend basically on the type of febrile seizure. If the type is simple febrile seizure, treatment actually no need. So simple, no need for treatment, only suppurative that include paracetamol given to decrease the temperature, to decrease the fever. Because in this attack that child had, if we decrease the fever, we will decrease the risk of febrile seizure in the same attack, but it will not prevent the other episode, the later episode, the future episode. But in case of complex febrile seizure or seizure that is last more than 10 minutes. Some resources, book resources says even more than 5 minutes, we need to abort it. And we will give a rectal diazepam for that. Those having a prolonged febrile seizure, we actually give a rescue medication that is actually a rectal diazepam that parents could give in the child at home when he had or she had another attacks, and it's also prolongs. So this will abort and prolong convulsion that could affect brain development and as a complication could lead to epilepsy. The risk factor of symbol 1 is actually not quite different from general population, it's only 2%. So risk to convert into epilepsy is only 2%, but this is not the whole story, because that in case the child had symbol 1. If the child had a complex febrile seizure or had an existing neurological impairment, or there was a family history of first-degree relative of epilepsy, then the risk would be higher. We can give a specific ratio for that, but it is actually will be more higher. For lab investigation, it's actually not necessary. Some people will ask if lumbar puncture is necessary or not. Lumbar puncture is not necessary unless there is a suspicious feature. The suspicious feature could include, unless we found there is a history of no adequate immunization that includes streptococcus pneumoniae and Haemophilus influenza, or there is the age is less than 12 months, and also in a case child had the seizure 2 days after onset, and the parents give the child antibiotic, and we're not sure if this is just a simple febrile seizure or a seizure that is coexist with meningitis and a CNS infection. In these cases, I mentioned all of it. I could not write it because it needs actually a lot of time. So in these cases, we consider lumbar puncture. That's the whole story of febrile seizure. And maybe I forgot to mention that serum iron and serum zinc is actually and vitamin B12 and folic acid and minerals. Let's say these two vitamins and 2 minerals is very important. So in the case of child having deficiency in these, we should give a supplement, because serum iron is very important in neurotransmitter health, and serum zinc is having function, let's say, with developing GABA inhibitory neurotransmitter. And for vitamin B12 and folic acid is also important in maintain the child and to have lesser risk to having a febrile seizure. If this lecture helped you in any way, your subscription will actually help us a lot. Thank you for your watching, and goodbye.